This is our second Mindfulness and Self-Compassion webcast that we are bringing to you in partnership with the Center for Child and Family Wellbeing at the University of Washington, and the Community of Mindful Parenting, the Charter for Compassion, and the Center for Mindful Self-Compassion. We are so grateful to these partners, to Ron Rabin and Yafa Maritz, to our fabulous behind-the-scenes Brazelton Touchpoints Center team, and to today's wonderful presenters, whom I will introduce in a moment. We bring them to you, working together with us to do what we can together to bring whatever comfort and relief we can in these difficult times. Parents and those of us who work with children and families may be pushing ourselves harder than ever, wanting to do whatever is in our power to try to make things just a little bit better. And that's why we're coming together today with all of you to just take a moment to take care of ourselves. To help us with that, we have with us today Kim Arthur, Shayla Collins, Patty Gonzalez, and Lena Liu. Kim Arthur is based at the Odessa Brown Children's Clinic in Seattle, where she works on culturally relevant mindfulness and compassion programs for parents and other primary caregivers. Shayla Collins is faculty with the Family Leadership Division of the University of Washington's Leadership Education in Neurodevelopmental and Related Disabilities program. Patty Gonzalez is the Parent-to-Parent Program Coordinator for Spanish-speaking families at the Arc of King County in Seattle. And Lena Liu is a professor of pediatrics at the University of Washington School of Medicine and Seattle Children's Hospital, where she practices at its Odessa Brown Children's Clinic. Thank you so much, Shayla, Patty, Kim, and Lena, and please thank for us your wonderful team. So let's go to you first, Lena.
Great to be here today. I want to start by just saying that as a pediatrician, Dr. Brazelton is a legend in our field. And so I'm just holding his memory and his legacy to remind me to speak to you today from my heart. I love mindfulness because, oh, sorry. Can you all see me? Okay, I love mindfulness because in contrast to all of the things we learn through our mind, mindfulness is something that we learn through our bodies, from inside. We call it an embodied or a felt experience. So we're actually going to start this webinar right off with a practice, a mindfulness practice that I will lead. And I would like to give credit to the teachers who taught me this practice and taught our team this practice. They are David Trelevin, who teaches trauma-sensitive mindfulness, and Stacy Haynes of generative somatics. So I will go ahead and lead this practice first in English, and then I'll be handing it to my colleague, Patty Gonzalez, to lead it in Spanish. And this practice is called the hand-fist practice. So wherever you are, everyone, I invite you to make a tight fist with one hand. If by chance you're not able to use your hands, you can use your imagination and just imagine a small animal or insect curled up into a ball for safety. If you're using your hand, go ahead and make that tight fist. And the job of this hand is to stay closed. And by staying closed, your hand is providing you safety. With your other hand, I'd like you to try to open the fist. And as you try to open the fist with your other hand, I want you to notice how each hand feels. Both the fist and the hand that's trying to open the fist. And then also taking a moment to just sense into the rest of your body, noticing how the rest of your body feels. Any thoughts that might be arising, any sensations, any emotions. And then you can go ahead and release that for a moment. You can shake out your hands if you want. And then we're going to try that again with the tight fist. We're going to keep that fist closed. The job of the fist is to stay closed. And again, if you're not using your hand, you can imagine a small animal curled up in a ball. This time, with the other hand, we're going to make this shape, like holding or cupping, and we're going to place our fist on top of this hand. And the message that this hand is sending to your fist is, I'm here. I see you. I got you. How wise of you to stay closed. I'm here with you. And just take a few moments to settle into the sensation in each hand, noticing how your fist feels, noticing how the holding hand feels. And then also sensing into the rest of your body, any thoughts, emotions, or sensations. And then you can go ahead and release that practice. And I'll pass the mic over to Patty to lead this in Spanish. And you can continue to follow along as she makes the hand gestures.
I think you're on mute. I think you might be muted, Patty. Patty, I think you're mute. You want to try again, Patty? Why don't we come back to Patty, and we'll ask if you can call in, Patty, and use your phone. We'll come back to this, and maybe we can move back to you, Lena, for the reflection. Okay. And we'll see if Patty can join us by phone shortly, and we'll get the phone number to you.
Okay, so we would love to hear your impressions of this practice. What was your takeaway from your experience? And since there's so many of you, if you can just chat a few words into the chat box, and Dr. Sparrow can let us see what he's seeing.
Calm. I loved holding my other hand. Support and calming, comforting, revealing, increased self-awareness, support, serene, peaceful, physical and real, centering, different perspectives, supported, nice holding, grounding, caring, balancing, pretty cool.
Great. So
we can't hear you, Patty. I think you'll have to call in with your phone. There's distortion on your internet connection, I think.
So thank you all for your contributions and input on that, that practice. I really love that practice because it gives you the felt experience of mindfulness as you were all describing. So this hand in the second part of that meditation or practice is what I think of as the hand of mindfulness and compassion. This is what we're trying to cultivate, or what we're trying to practice in mindfulness, is the ability to hold any experience that we have, hold any emotion with compassion and unconditionally. I sometimes think of this as self-parenting, learning to love and hold ourselves lovingly and unconditionally. So I'll just speak very briefly about how mindfulness came to me. I went through as with many people, it came to me through a personal experience. I went through a very difficult time during my life. And I had been practicing yoga for many years, but for a long time, it had been more like exercise for me or relaxation. But as I was going through my divorce, this challenging thing in my life, yoga really transformed into something much more healing for me. I remember being in yoga class and going through the yoga postures and crying. And I think that that movement held in that safe space that was created by my teacher allowed the emotion and the tension to be released from my body. So after having that personal experience, I really felt that I wanted to bring mindfulness to my medical practice and to pediatrics. As you heard, I work at Odessa Brown Children's Clinic in Seattle, and many of our families are struggling with inequities from socioeconomic status, poverty, racism. And many of the children that we take care of experience what we call adverse childhood events, or ACEs. I'm sure you guys have heard about that. So very, very significant challenges in their life, such as abuse, domestic violence, parents with significant mental illness. And, you know, as a doctor, it's very hard to hear those kinds of situations and not feel like I can do anything to help. But when I learned about mindfulness, I realized that there was a clear role for bringing this into pediatric practice to support parents. And then I knew that if I could support parents, I would be able to help take care of the children better. And so that's how we started developing programs. I just wanted to say two more quick things, which is that mindfulness is not a panacea or an answer to the inequity of the world. You know, social inequities and injustices still need to be addressed through advocacy and social change. But I do think that mindfulness has a role in helping us all to see these inequities more clearly, much as COVID is doing with sort of illuminating these inequalities in healthcare. Mindfulness can also help us know how to act more wisely in advocating. And also with my personal experience, I really feel like when I was struggling, it brought me closer to my patients. It deepened my sense of compassion for people who are struggling with any kind of condition. And I think it's important in our healthcare and educational spaces that we as providers have the room to be able to deeply connect with our patients, because that's really where the healing occurs. And so it's from this place of deep connection with my families and equality in our roles that we began to co-create this program for parents. And I'm really excited to have the rest of my team get to share that with you. So let's see if Patty is connected now and we can hear from her.
Can you hear me now?
Yay!
I'm back. Sorry for the
Oh, we're so glad to have you
technology is
back.
not. Yeah.
So Patty, would you like to go back and give us the hand meditation?
Sure. So let me start with that. Sorry for the matters. You know, this is happening in the real life. So, yeah. So let's start with the meditation. La meditación del puño. Me gustaría invitarles a cerrar el puño con una mano. O si prefieren, lo pueden hacer imaginando un animal o un insecto en una burbuja que lo hace por seguridad. la función del puño es permanecer cerrado. Con la otra mano, intenten abrir el puño. Al hacerlo, observen cómo se siente cada mano. La mano del puño cerrado o la mano que intenta abrirlo. Toma un segundo para explorar cualquier sensación que esto pueda producir. También pueden notar cualquier pensamiento que tengan o sentimiento o sensaciones en el resto del cuerpo. Ahora, déjenlo ir. Pueden estrechar sus manos o sacudirlas. Ahora, por favor, vuelve a cerrar el puño. No importa cuál puño cierres. Nuevamente, la función del puño es permanecer cerrado. Esta vez, los invito a tomar su otra mano para que sostenga su mano con el puño. El mensaje de la mano sosteniendo el puño es: aquí estoy. Te veo. Qué sabio de tu parte permanecer cerrado. Te tengo. Y luego, coloca tu puño en esta mano para que sostenga, para que pueda descansar. Y como antes, observen cómo se siente cada mano. Tu puño y tu mano sosteniendo el puño. Tomen un momento nuevamente. Después pueden notar cómo se siente cada mano. Noten cómo se siente el resto del cuerpo. Y con esto ha concluido esta práctica. Gracias.
Gracias a tu, Patty. Just a few more comments. I realized my tight fist was not resisting and tight anymore while resting on the cradle of my other hand. Life is heavy right now with everything that is going on. The hand helps to support, just as we would as providers. I liked how the other hand told the fisted hand how clever it was to stay closed. Thank you so much for sharing honestly and with authenticity. Your vulnerability is so greatly appreciated and valued. Hearing it in Spanish also feels so healing, feeling tearful with all the resonances. Hi, Patty, gracias por hacerlo en español. And then, sí, es más importante cada día soportar gente Latinx. So calming to hear it again in Spanish, even though I'm an English speaker. Thank you. So we're back to you, Patty, for the comforting touch meditation.
Okay, thank you. Okay. Bueno, los quiero invitar para que cierren los ojos o si desean, pueden mirar directamente al suelo. Tomen un momento para sentir las plantas de sus pies conectadas con la tierra. Respira profundamente un par de veces. Ahora, imagina y siente si tener un objeto en tus manos. ¿Cuál es la textura? ¿Cuál es su temperatura? Intenta sostenerla con mucha fuerza. Observa cómo se siente. Ahora sostén el objeto con más suavidad. Intenta acariciar el objeto. Intenta rotarlo. Ahora sosténlo en tu mano. Traslada tu atención del objeto a todo tu cuerpo y nota cómo se siente tu cuerpo en este momento. Si quieres, vamos a continuar este ejercicio usando nuestras manos sobre nuestro cuerpo. Recuerda que puedes seguir sosteniendo el objeto en tu mano con una o con dos manos. Si deseas, coloca una mano sobre tu corazón y siente el calor delicada de la presión de tu mano. O siente la textura del objeto que está en tu mano. Si lo deseas, coloca ambas manos sobre tu corazón. Siente cómo sube y baja tu pecho de forma natural mientras inhalas y exhalas. Si estás obteniendo un objeto, siente la calidez de tus manos sobre el objeto a medida que inhalas y exhalas. Algunas personas se sienten incómodas al poner una mano sobre el corazón. Siéntete libre de explorar qué parte de tu cuerpo las caricias pueden llegar a ser realmente reconfortantes. Si deseas, piensa en uno de tus niños si tienes y lo que haces para reconfortarlos cuando están tristes, o en una mascota. En esta actividad estamos entregándonos cariño a nosotros mismos, de la misma forma en que los papás y los abuelos entregan cariño a sus hijos o a sus nietos. Tal vez quieres explorar colocando una mano en tu mejilla o sosteniendo el objeto en tu mano. Abraza tu cara si deseas con tus manos o abraza el objeto con ambas manos. Tal vez quieres acariciar suavemente tus brazos o pasar suavemente el objeto sobre ti o sobre tu mano. Puedes colocar una mano o ambas sobre tu vientre o simplemente sobre tu mano o la otra. Coloca tus manos sobre tus muslos o deja que tus manos sostengan el objeto descansando sobre tus muslos. Ahora que has intentado diferentes tipos de caricias reconfortantes, siente la piedra en tu mano o el objeto que tengas o las caricias de tu mano. Quizás una mano sobre el corazón para cerrar la actividad. Respira profundamente. Lentamente, expandiendo tu atención desde el objeto a tu mano o todo tu cuerpo, que está sentado aquí en esta silla y en este lugar. Cuando estés listo, puedes lentamente abrir los ojos. Okay. Okay.
Okay. Thank you, Patty. Did you want to share your reflections before, or your teaching points before we go over to Shayla, who will also talk us through a meditation?
Sure. En Spanish and English, I forgot.
Los dos.
Okay. Okay. I will, lo voy a hacer primero en español y después en inglés, considerando que español es mi primer idioma.
Okay. So first in English, first in Spanish and then English, because Spanish is your first language. Okay.
Yeah. La idea de esta meditación y el objetivo es darle la oportunidad a las personas de meditar de una manera sin tener una estructura básica que ellos tengan que seguir, porque tienen la habilidad de tener las acomodaciones de acuerdo a a habilidades. Por ejemplo, hay personas que tienen dificultades tocándose, entonces el punto es que tengan un objeto. Regularmente les proveemos en las meditaciones una piedra para que tengan, pero también les damos la posibilidad de que puedan tocarse si tienen la habilidad o si desean, si es cómodo o reconfortante para los participantes. En mi experiencia, yo inicialmente cuando comencé con este proyecto, yo no era capaz de tocarme, teniendo en consideración que tengo traumas de abuso sexual y violencia doméstica. Entonces pregunté si había la posibilidad de tener, de no tocarme, que no era capaz. Y encontramos que tener un objeto adicional como opción era muy, muy reconfortante. Ahora en este punto ya soy capaz de tocarme, pero todavía creo que hay muchas personas que deben de tener la opción de tener un objeto o algo que puedan ellos tener en sus manos para hacer la práctica. So the idea to provide an object or something to hold while we are leading the meditation is to have an object in their hands if they are not able to touching themselves, because if some, we know that there is a lot of people who has been struggling with sexual assault or harassment or domestic violence. So we give them an options and the opportunity to have the option to explore different options and the ability to continue practicing the meditation with the variety of options of, yeah. It is very important for the people to have that options, since this is more adaptable for and inclusive for everybody. Yeah, I think this is what I have.
Thank you, Patty. I just wanted to bring to you all of the appreciation in the chat, feeling free and calming. Thank you. I don't understand a word of Spanish, but closed my eyes and felt deeply humbled and cried. Thank you. So calm and beautiful. Muchísimas gracias, Patty. I deeply appreciated the meditation in Spanish and for supporting the Latino community. Thanks. Patty's voice helped me relax and remember to breathe, even though I didn't understand the words. Thank you, Patty. So let's go to Shayla, unless there was more that you wanted to add first, Patty, before you go to Shayla.
Yeah, I think something that I would like to add is to take in consideration how important it is to bring this kind of program for the multicultural people who have been able to access these kind of services, because the variety of the challenge that we facing daily as an immigrant. So I think as an immigrant and as a Spanish-speaking mom, I can say this program convinced me initially as a mom. I took as a mom because I have been dealing with a lot of emotion and traumas, how I mentioned before. So I have been getting any access to this kind of programs, and I know it is important to have a professional who can provide health, mental health services, but also it is important to have a different options that is now have a lot of structure where we can play with and do on our way. Even when we are driving, we can have that skills. I think it is really valuable for our community and important to provide these kind of services. So I really appreciate the opportunity to be in with this awesome team and have the opportunity to bring back this to my community. I feel like that's gonna be a huge gift for my community, and I'm so excited to provide this for more people in our community, not just in the county, but more people who can also available to access to the online Zooms that we haven't preparing for the people now. So yeah, this is what I have to add.
Thank you, Patty. Well, there are lots of people who are very grateful to you. Thank you, Patty. Very important in bringing mindfulness into our Spanish-speaking communities. Really appreciate the object option. Thank you for acknowledging the trauma that many of us have experienced and giving us other avenues. Gracias por los términos en español. And the idea here is that the words in English, really don't stand when they're translated, and you have just offered how to think about and say these words in ways that make sense in Spanish rather than simply translating. Thank you so much. And I could go on and on. There's so much appreciation in the chat for you and your gifts to all of us. So let's now go to Shayla.
Sure, thank you.
Hello, everyone. I'm Shayla. First and foremost, Patty, you killed it. That was beautiful. Thank you for that very much. And I will be leading that same meditation in English. My voice is not as calming and sexy as Miss Patty's, and no si habla español, everybody, but we're gonna get through it. Before I get into this meditation, I want to make sure I highlight Patty a little bit more. She doesn't need it, but I'm gonna give it to her. After the Spanish team adapted that practice for it to be more appropriate and brought it back to our English team and let us know about the changes that were made and the reasons for them, we then made adaptations to our English script. So I want to make it very clear. It did not go where we wrote it in English, then Spanish, do it this way. No, it was really, really, really thinking about all of our communities and the people as individuals that we were dealing with, and not re-traumatizing or disrespecting or hurting anyone. So again, I want to tell you, Ms. Patty, thank you for your leadership and your guidance on that. All right, everybody. So you heard about having the object before we start the meditation. So I invite you, if you have a moment, to grab something, or your cat, your blanket, your fuzzy slippers, and we're going to use that. Our meditation uses the word stones because in the classes, that's what we passed out. One day we forgot the stones, and I'll tell you, we use leaves on the trees outside. I mean, you can get creative. But when I read the meditation, the word I'll try to use is item. If you hear stone, no, that's just my automatic system doing that. So, all right, we'll get started, everybody. All right, please either close your eyes or lower your gaze. Take a moment to feel your feet on your floor or on your couch. Now let yourself take a few deep breaths. Now notice how you're holding your item. What's its texture? What's its temperature? Try holding it a bit tighter and see how that feels. Now soften your hold a bit. Try rubbing your items with other fingers. Maybe turning the item in your hand. Now hold it in your other hand. Now please broaden your attention to notice how your whole body feels in this very moment. Now, if you'd like, you can set the item down. We're going to do this exercise using our hands on our bodies. If you choose to continue to hold your item, feel free to cup it in both hands. If you've set it aside, please gently place one hand over your heart, simply feeling the gentle pressure and maybe the warmth of your own hand. If you wish, place both hands over your heart. Feel the natural rising and falling of your chest as you breathe in and out. For those of you who held on to your item, feel the warmth of your hands on it as you breathe in and out. You're going to hold that for a moment. For those of you who put your hand over your heart, it may feel uneasy. Feel free to explore wherever on your body this gentle touch is comforting. There are other possibilities you could try, such as placing one hand on your cheek, cradling your face in both hands, gently brushing your arm with one hand, or placing a hand or hands on your belly. Or maybe your thighs. For those of you who are using your hand, you're going to hold whatever position you're in for a moment. And for those of you who are holding the item, have it in one hand first. Now cradle it in both hands. See if you can gently roll that item in your hand or pass your your item from one hand to the other. You may now let it rest in your lap. And now all of us coming together, now that you tried different types of connection, choose one with your item or your hands to hold on to for 3 slow breaths. You might imagine offering this to yourself at some point during your day or when you're having a difficult moment. Whether you are working with your hands or the items, I ask you to take one more deep breath and come back into the Zoom. Thank you. All right. I think, Doc, I'll let you do comments when you're ready.
Okay, thank you, Shayla.
You're welcome.
There are some really wonderful comments. There are, there's some really terrific comments here. There's one, let's see. Saludos de una venezolana desde Fresno, California. Hello from a Venezuelan woman from Fresno. There's another, Patty, un saludito desde New Jersey. ¿Y tienes una clase de yoga? Tengo mi cuello y hombros tensionados por estar muchas horas usando el computador por trabajo, which means, hi, Patty, I'm from New Jersey, and is there a yoga class too? Because my shoulders and back are really tense from having to be at the computer all day long. I thought I'd share that with you because I think we can all identify. And then this was a wonderful, great reminder of our support in our community. I need to relax or meditate. Your voice is calm too, Sheila. Thank you. Thank you for sharing with us. I have never been more relaxed in my life. And listen to this one. I love this one. My 5-year-old son heard your voice, Sheila, and started to follow along. When you asked, how does your body feel? He took a deep breath and said, my body feels calm.
Oh,
And we have, isn't that great? Feeling very relaxed, ready for a nap, someone said. And I think that's great because naps are so healing. Soothes, brings balance, and calms my soul. And then one person said, I find it hard to relax. Thank you. This will help me to calm my thoughts.
Thank you all. This is about all of us and us trying to figure out what helps make us tick and keep us ticking, particularly right now. And we are honored to share this exercise with you. And I just want to make sure that I'm telling you that with full transparency, how incredibly important and extremely personal touch is. And even me coming back to think about my own experience, touch is a bit controversial when I think about my parenting, because when I had my son, I didn't get to touch him for days. I didn't get that skin to skin contact. So thinking about that experience, and then I also just, again, I share everything. I have Crohn's, and for those of you who don't know, it's a autoimmune issue that brings quite a bit of pain, and I don't want to be touched. And so learning how to comfort myself using touch has been and is continuing to be a journey. I'm a work in progress. I learned it's called a WIP, W-I-P. And so know that this is all about practicing and finding out what works for you. And know that it may take some time. It might not be right now. It may come later, but especially since we're thinking about COVID-19 with the social distancing and the lack of engagement with some of our loved ones and our friends, this tool may be helpful for you, and it may help you on your journey to finding other tools that may work for you. And I myself wish you nothing but the best, and I'm taking some of y'all's tips too in the comment boxes for myself. So thank you very much for allowing me to share that with you all. Back to you, Dr. Sparrow.
Thank you, Shayla. Well, there are so many more who, you started out, Shayla, by saying you didn't have such a calming voice, but there's all kinds of people who are like really disagreeing with you and appreciating your voice.
Thank you. They're trying to make me feel good, Doc. I appreciate y'all out there.
So let's do a little bit of self-compassion here. Let's treat yourself the way you would treat your dear friend.
Thank you.
So, well, there's more, Shayla. Very comforting. I found myself holding my face with both hands, something I rarely do. My back pain is relieved. I felt like I was floating in my office chair. Thank you. Wow. I have never felt that way before, just running my hands over my arm. That was so incredibly grounding, bringing a compassionate connection from my hand to my heart. Thank you, Shayla.
Thank you.
So let's go to you now, Kim.
Okay, thank you. I am so honored to be here with all of you today and with our team. And as those of you on the call have experienced this, I have to say that I am here and where I am right now because of these women. So first I want to thank Shayla and Patty and Lena and Foxy Davison and Fahmo Abdul and Araceli Mendez, Angie Tamayo Montero, Ofelia Rosas, Krista Hansen. I wrote them down so I wouldn't forget anyone on our amazing team, Sarah Bergman Lewis and Catherine Thurber Smith. And also a thank you to Ron Rabin and Yafa Moritz. I think, you know, it was beautiful even just today to see our team in action, because even with tech difficulties, rallying and showing up and being there so fully. And I have seen them show up at other times like that too. There was a time when there was a shooting near where we were going to have our mindfulness class. And we were on the phone back and forth, should we have it, should we not? And they wanted to go ahead, felt that it was safe in that area. The building was in lockdown, and we went ahead with it. And one of the things I remember, I wasn't there in person, but I remember Shayla saying to me, you know, this is what happens all the time. Like, this is when people need us to show up. And now we're doing our best to do that during COVID as well, and trying to figure out ways to do that over Zoom. Which sometimes means one-on-one supporting a family with figuring out how to use Zoom for the first time. And so I want to also just say that in this time, like, I can see that all of you, from your comments and where you are, that you are the people who are out there supporting others, whether it's in your family or in the organization where you work. I saw the comment of someone waiting outside the emergency room right now, listening to this, and all of us on that call, on this call right now, can now think of you. For soothing touch, comforting touch, I'll go ahead and go to the next slide, please, and just share a comment from a participant. Oh, the previous one. The previous slide, please. Thank you. This is a person who participated in the comforting touch meditation, and she shared that she actually did not feel comfortable touching her body, but the part with the rock is what helped her. And so she said, me tocó una roca rara, yo la escogí. Entonces yo dije, esta roca se parece a mí, porque tiene muchas cicatrices, muchas quebraduras, muchas cosas. Sabrá Dios por cuánto ha pasado la roca. Se parece a mí. La hice parte de mí porque cuando decían que la disfrutara, que la acariciara uno, entonces yo dije, pobre roca. Entonces la comparé conmigo, la hice parte de mí. Entonces fue algo que sí disfruté, la roca. De mí depende si yo sigo maltratando esta roca o si yo la guardo y le doy otra vida. And I'll let her words stand on their own, and just add that this is one of the things that our class is all about, is providing simple things that you can use when you're waiting outside the emergency room, for example. I have used them at times when my daughter was going into surgery and they were putting the anesthesia mask on her face. And it's all about finding what works for you. And for me, like, I put my hand on my stomach and take a breath, and sometimes that helps. Today, before talking with all of you guys, when I was feeling flooded, I decided I'd listen to Patty's meditation on the floor, because that was what I needed. And I think that's what I've been trying to learn to do, is to give myself what I need in the moment. And the next slide, please. And I just have now a couple minutes to try to summarize a little bit of what we've experienced together. And, you know, equity being the first point there, there's so much to say about equity, and that could be multiple webinars. But what we wanted to emphasize is that we think that having equity front and center in the process of how we do our work and how we learn from each other is what gets you to these outcomes of trying to not only make these classes available to people who wouldn't necessarily have access due to a language barrier or the cost or the location or not knowing how to use Zoom or not feeling comfortable in a Zoom call with showing your face and saying comments to a computer screen with people you may or may not have met. And so those are the outcomes we're aiming for. And the way we get there is by really being together and supporting each other and encouraging each other to share, no matter what your role is, no matter what language you speak originally on our team, to come and bring your thoughts and we all are doing similar work. We're not having a group of healthcare professionals go off into a room and develop something and then offering a focus group, asking parents for their opinion, and then calling it good. We're actually doing the work as parents and healthcare partners. And this is a small but very concrete and important point. Parents on our team are paid as independent contractors for their work. This isn't about giving someone a stipend or a gift card for contributing their opinion a couple times. We are valuing parents on our team just the same way we're valuing healthcare partners. And then also about equity, I can tell from some of the jobs that you all have mentioned in the chat box, I can tell you're out there doing this work. And if we offer these mindfulness sessions on Zoom, I'm seeing them coming in my inbox, from different places. If we're doing this and we're not thinking about how to reach people who are new to Zoom, who are uncertain about appearing in a Zoom room, if we're offering these classes and not making the effort to make them accessible, we actually will widen the mental health disparities that are already there, because we're going to be providing support to the people who have the ability, time, space, resource to get to a Zoom session, and leaving out the people who are struggling the most and who are getting sick more frequently now and who are dying more. And we would be leaving those communities out. Two last quick points. One is the importance of community and how we heal. Really, community is the active ingredient, and it's the common humanity from Dr. Kristen Neff and Dr. Christopher Germer's curriculum of mindful self-compassion, about realizing that other people out there are suffering and struggling too, and that helps you get through and realize it's okay. And finally, that experiences are how we learn and how we grow. And we focus on offering an experience and then inviting people to put their own words to it, rather than developing a whole bunch of terms and concepts from on high and then delivering them to people who show up. We're actually offering an experience and inviting people to reflect on what they're learning and experiencing, and then share that with others. And finally, we try to focus on compassion to go, or mindfulness on the go, as you see my daughter's book there. This actually was not staged. She picked up this book 2 days ago in my messy living room and then was distracting her twin from her remote schooling. And I was telling her to put down the mindfulness book, and she was saying no. And I said, put down the mindfulness book. And she said no. And so I was realizing in choosing that photo, it was kind of a funny one to choose after all. But I wanted to end with Shayla's words. There are many times that she has said to me, you're doing the best that you can. You couldn't possibly be trying any harder. And we're all in this together. And that's my quote that I wanted to end with today. And we will share a slide for more information information for you with our website. We have Patty's beautiful voice recorded in meditations. Lena is up there. Shayla will be at some point. We also have another parent facilitator, Krista Hansen. So recorded meditations there, and contact information, and everything we have to offer. So thank you.
Thank you, Kim. Thank you so much, Lena, Shayla, Kim, and Patty, Yathwa Maritz, Ron Raven. Thank you all for joining us, and thanks also to our behind-the-scenes team at the Brazelton Touchpoints Center, Ashley Gaddis, Kayla Savelli, and Autumn Strasbow. And thank you, Barry Brazelton, for showing us the healing power of being present with babies. You can go to the Brazelton Touchpoints Center website to watch this webcast again when we post it soon, or to watch the first one in this series. And please come back again on Wednesday, June 24th at 12 noon Pacific time, 3 p.m. Eastern time, for our third Mindful Self-Compassion, Co-Creating Hard Skills with Communities webcast, which will explore how early childhood programs and systems use mindfulness and self-compassion to support diverse providers, families, and communities. Be well.